Hey, welcome to another edition of the Full Arch Masters podcast. My name is Dr. Ryan Dunlop, and I'm joined here today by three wonderful docs from all over the world. We are here in Fresno, California, and it is September 2023, and we are about to finish up another edition of the Full Arch Masters flagship course. So just introduce yourself, tell us a little bit about yourself, where you're from, what kind of dentistry you do, and let's meet you guys.
Great. I'm Dr. Brandon Romich from Cincinnati, Ohio. Have several practices in the greater Cincinnati area. Mostly practice just general family dentistry. Dr. Deshmukh and I actually are kind of venturing into more of a separate full arch entity where we'll be focusing just on full arches, and that's why we're here. That's why we're here doing this. So, yeah.
Thanks.
Thanks. Appreciate that. Dr. Deshmukh. I'm an oral facial surgeon, also from Cincinnati, Ohio. My practice right now is pretty much restricted to private practice, doing some hospital-based cases as well. But I got the itch, learning a little bit more about full arch cases. And Dr. Romich and I just randomly met, and things have really kind of moved forward pretty quickly. We're trying to lay the foundation, and really have heard great things about things that you're doing in your course, especially with digital workflow. And so we're excited. We've learned a lot. We appreciate all your advice and tutelage. So,
well, welcome. And,
thank you.
Doc, tell us a little about yourself.
Thank you. I'm Devin Vaghela. I practice in Bristol, UK, and in Nairobi, Kenya. Like the other gents, it's good to have been here, looking at your workflow, how to see if we can increase our efficiency, our protocol. So yeah, it's been a good week, and looking forward to putting things into practice.
Awesome. So you guys spent the last couple of days learning from the Full Arch Masters team. I want to talk a little bit briefly about the clinical experience that you guys had. So on the first day, we have you guys in the op watching surgery, and then periodically throughout the week, we have you in kind of live patient settings. Tell us a little bit about your experience with our clinical exposure and how important you might think that is.
Well, I think it's great. I think, for a lot of people, the intimidating part is you can read a book, you can look at it, you can view it on, Instagram, online, YouTube. But, when you see it live and you see it spelled out in front of you step by step, I know that's the way I learn. And I don't think you can put into words how important it is to be able to see that. And once you do see that whole process live, just the level of comfort changes completely. And it's all laid out really, really well in front of us step by step as you're going into it. And to see that all play out in a live setting is priceless.
Any thoughts on the clinical session?
Yeah, I appreciate that as well. To put a personal touch or kind of, my own personal experience is a lot of referring dentists that I work with prefer to do their cases or plan them using guides.
Right.
And so I thought that was a pretty valuable experience for me to see and learn, some of the techniques that you're using, see some of the visual cues
right.
That you're seeing. So there was a lot of power that came from that. So yeah, I think that's a great asset to the program.
Cool.
Yeah, absolutely. I think going over it again kind of reinforces it as well. So it was good. It was good to see.
Awesome. Well, let's talk a little bit about technology, right? So there's a heavy set of technology that gets kind of demonstrated to you guys over the course of this program. So what were some of the technological things that really stood out to you as being amazing while you were here?
Well, I come from a digital practice and knew a little bit about what we were looking for, but honestly, the photogrammetry is an impressive part of it. Really, all of it coming together. For me, a lot of my interest lies in the lab and the process of seeing that all come together in the lab you have, I think, is really important as well. And that was one of the most impressive things to me, to see how all these scans and everything finally come together in the lab to be able to come out with these restorations is pretty incredible. And it's wild, having graduated dental school in 2000, to see this kind of stuff going on now is pretty amazing.
Right. Technology, any thoughts?
I think we hear about how dentistry is advancing, and you think about where just in the few years full arch has come as far as the way that you can clinically pick up,
Right.
The impressions and how accurate things have become now. I think that's a huge plus. And not only that, but it's created just an incredible amount of efficiency in the process. So,
Yeah, I agree.
yeah.
Yes, for sure.
Any thoughts on technology?
Yeah, certainly Gammetry was an eye-opener for me. And seeing the whole process from Gammetry to merging and stitching all the STL data on ExoCAD, we were in a lab with absolutely no plaster whatsoever, So the whole the printing precision, the curing side of it, and then to see that final fit absolutely passive on our models, that was just fantastic. That's good. Yeah, that was
Fun stuff.
Yeah.
Well, so we're here on day 4 of the course. We're not done, but we're close to done. What's on your radar for the last half day that you're going to spend here at Full Arch Masters?
What do I need to buy to finish out the week?
Shopping list is very
the
important.
The shopping list.
Yes.
What little things do we need
We've
out in
kind of
there?
collaboratively put that together.
Yeah.
Right.
That's pretty much it. Honestly, just looking back through the week, and we're excited about just implementing everything. Just after a week like this, you kind of sit back and you leave these courses. I think this one in particular, we're just excited to implement it all. But yeah, grabbing the things we need to get going in our own office, and then just putting it all to work.
Very important.
Yeah.
What's on your radar for the rest
I think
of the day?
we have similar goals and aspirations, and so I think shopping list is at the top of our list. But I'd like to talk to a little bit of the admin team.
Right.
Go over some of the patient intake.
Right.
Talk about patient retention, or I shouldn't say patient retention, but just more
Acquisition.
acquisition.
Yeah, very important.
Exactly, and maybe go over some marketing techniques.
Cool.
Yeah.
Very valuable.
So.
Any thoughts for the last half of the day here, Doc?
Definitely spend some time with your lab guys and your coordinator as well, just to kind of streamline that process a little bit, But yeah, no, thank you.
Awesome. Well, you guys are 3 amazing doctors from totally different walks of life and different areas. But one thing that stands between you is you're all wearing the same jacket, right? So you've now, graduated and joined this growing group of passionate full arch doctors, and we wear our coats as kind of a symbol of pride of this group. And so how does it feel to now be part of this worldwide phenomenon of Full Arch Masters? And does that mean anything to you?
Yeah, absolutely. I mean, it's pretty amazing. And when you look at, leading into this course, I always found it was very difficult to find somebody that tied it all in, and your name kept coming up in this course. And we know somebody had been through it. And
Actually, no, multiple people.
Yeah. And now that you can see you are kind of a part of a pretty elite group. And I see this being the future of Full Arch. I mean, I don't know why digital isn't going to be obviously the way to go in the future with everything, and to be on the forefront of all that is a good feeling.
Good. Any thoughts about our camaraderie?
Yeah, I think that when in the past I attend a course, you get amped up about doing certain things.
Right.
When you come in, I think with a vision and a goal, and you've talked to colleagues that have implemented certain things that have aided in their evolution of their practices.
Right.
I think the jacket just symbolizes that feeling, of saying, what, I'm gonna make it happen.
Right. It's a symbol.
So, yeah.
And you get to be the first green jacket wearer in from the African continent.
Well, it's great to feel inclusive and energized.
Right.
It's good, and it's nice to kind of meet you guys finally, and to be here.
And you were referred by an alumni as well.
I was Dr. Mantenna, who you came highly recommended, and it's been good.
So it's a true natural process of referral.
It is.
I mean, maybe you'll refer the next doc from
It's certainly 100%
the
organic.
continent. You never know.
Yes.
Okay, well, thank you guys so much. I appreciate all of your time. You took a lot of time and effort to get here, leaving your practices and your families, and it takes a lot of effort to get here. So I applaud you guys for that. Our Full Arch Masters really prides itself on the support that you guys will get from here forward. And you guys had an amazing experience, but really it's the follow through and helping you guys achieve your goals that really defines us. So if you thought we did a pretty good job during this week, then I'm quite sure you'll be equally, if not more, impressed by our follow through and helping you get to that destination of being able to do these cases, regularly in your clinic. So
Absolutely.
I appreciate you guys, and just know that we've got your back.
Thank you. Thank you very much. Yeah.
So thank you for joining in for another edition of the Full Arch Masters podcast. I'm Dr. Ryan Dunlop, and we are here on day 4 of our flagship course in Fresno, California. If you want to get more information about any of our courses, you can check us out online at fullarchmasters.com, or you can check us out on all the socials, Facebook, Instagram, and YouTube. You guys have an amazing day, and we will talk to you soon.